Representative Danny Rovero, Representative Christine Rosati Randall, and I were proud to testify in support of Senate Bill 49 and act exempting small community hospitals from the hospital tax. We were proud to be joined today by the CEO of Kimball Healthcare, Bob Smanik, and together as a team we were able to advocate for small community hospitals and why changing the designations for the hospital tax would provide much needed relief for a healthcare system like Kimball that's so critical in northeastern Connecticut, a community that strongly supports the hospital, but it's a community where a lot of people struggle to get by, a place where transportation is a challenge. And so if Kimball Hospital has to cut critical services or make other reductions in the future, our economy is going to be at risk in northeastern Connecticut and our healthcare system. I'm really glad to have the advocacy of Bob Smanik here today as well.
It was a privilege today to be asked to join with Senator Flexer and Representatives Rosati, Randall, and Rovero, and to acknowledge their leadership in introducing this Bill 49 and representing the fact that today hospitals aren't all the same. Kimball Hospital, Northeast Connecticut, needs to have special consideration by the state, as do other smaller community hospitals, because of the cumulative effect of the reductions in payments and the tax system that has evolved in our state. And we're at the point in Northeast Connecticut where access to service is truly in jeopardy. Northeast Connecticut and its community hospital have focused on the care most necessary for its residents, and it's done it in a remarkably cooperative way, medical community in general, and hospital employees, and it's just a shame to see it so jeopardized.
I was very happy to introduce this bill along with my colleagues, Representative Rovero and Senator Flexer. This is a very important piece of legislation because Kimball Hospital is so critical to our community. They're not only a hospital, they're a healthcare system. And through their work, they have been able to bring providers to this region, specialists who weren't here previously. And as a parent myself, I'm greatly concerned about what's happening with our maternity services. I want to make sure that obstetrics remains in Northeast Connecticut and that everyone that needs access to health care has access to health care. And we have unified as a team to work collectively towards this issue, and we will continue to fight for Northeast Connecticut.
This is such an important part for our end of the state. Everybody doesn't realize that if Kimball Hospital was to close, the closest hospital for us to go to would be 30 miles away. And anybody that's had any critical condition realizes 30 miles can be a matter of life and death. So this is some legislation that I'm so proud to present along with our CEO of Kimball Hospital. That without this here, we could be in serious trouble in Northeast Connecticut.